nets. It was that period that I understood that a lot of people did not know that there are mosquito repellent creams. That was when Odomos came to light during that period. So I think that with health literacy, as medical doctors, as health practitioners, we should be able to step out, go into communities, organize an outreach, take 5 minutes in your place of worship to speak to them about their health, to speak to them about digital tech. Wherever you find yourself, in your house, speak to your parents about it, tell your parents to tell somebody. I feel like those little bits of change would come together to create something big eventually.
Thank you very much. Now, as a follow-up from what she has mentioned, Ms. Sarah, do you think that health literacy would be enough to deal with policy reforms and the effect that policy reforms would actually have in establishing healthcare innovations in this country for good purposes?
Yeah, I think, she said, the first step is awareness, right? And the second step is maintenance. I think in this part of the world, we are not exactly great with maintenance culture. So if you are establishing, let's say, an agency that's in charge of creating awareness for this, over time you just realize that a couple of those programs just disappear. You have a first year program, somebody is trying to create awareness, second year they are nowhere to be found. So I think that continuous awareness would always help, but there has to be like some sort of development of maintenance culture, because we're not exactly used to we're not exactly part of this entire maintenance chain. I'm creating awareness on malaria today. I might not be the next person I might not be available to continue that program. Have I impacted somebody to create such knowledge in the following year? So every single day a child is being born, there needs to be more knowledge passed, there needs to be more awareness created. Like she said, in the underdeserved environment, there are a couple of people that don't even know some of these things exist, quote and unquote, right? So I think that there has to be like some sort of maintenance and continuity in awareness, basically.
All right, I should also clarify that I would love that you also answer this. In our society right now, is there a space, or is there a space in the government for medical professionals as well as technology enthusiasts in the government space, such that the policies that are made in the healthcare sector can show that we are indeed thinking, we are having a forward thinking concerning healthcare innovation?
Yeah, I think for every innovation, there has to be a team enforcing that innovation. I was speaking to someone earlier this morning, and they were talking about a project that we're currently working on. And it says, the team that used to be in charge of this project in the state ministry in Lagos has been scrapped. So I think that there's always an opportunity for these policies to be enforced. However, there has to be like some cascading of these agencies or these teams across the state level. That way, there's an opportunity for the innovation to play out.
All right, thank you very much. Please can we celebrate the panelists? Thank you. And also joining online, we have Dr. Kenneth Igwe and Mr. Adeyemi Olutoye. And so I would be starting first with Mr. Adeyemi Olutoye. It's a pleasure to have you on board. Thank you very much for joining, sir. Well, my question is this. In recent times, we have seen that there has been an advent of healthcare startups in healthcare innovation across Nigeria. And despite that, there is still a serious lacuna between people that can gain access to this already established structure for healthcare. And so the question is, how do we think that as a country we can leverage this to address the healthcare challenge that we face? And how do we also bridge the access gap that we experience right now? Hello, sir. Did you get the question, sir? All right, I think we'll come back to that. So I'd like for Mr. Iberi to attempt the question, please.
Okay. So, how I think Nigerian can leverage digital health tech. I mean, the first thing I would say is government collaboration. I think that's very important. We said it's all day today. Public cannot do everything, and then the private sector cannot also do everything rather. The public and private collaboration will help to make digital healthcare more accessible, especially to like unserved communities rather. When government invests in private sector, when government invests in health startups, it's easier for growth, it's easier for them to scale. So government showing interest in health startups helps them to grow faster. It gives them the leverage that they need. It also helps to scale where places where private sectors cannot go on their own. The government helps to build up. An example, say where I work right now, pharmacy, collaborates with the government of Lagos State, and then we start to maybe deliver medications to we use the Lagos State connection, start to deliver medications to people in unserved communities, like Lagos, say Makoko area, where they do not have a very good healthcare system. That way, with the government support and the presence of the startup, it's easier to get to those locations, it's easier to serve people, it's easier to give accessible healthcare, quality healthcare to these people. So where private sectors or where private startups can get to, with government help, it's very, very easy to get to these places. Yeah, thank you.
Yes, thank you very much. So I would also love to confirm if Dr. Kenneth Igwe can hear us clearly. It's a pleasure to have you online, so thank you very much for joining. Question is that right now we know that many of us in this room are probably students, and so we are the future of medicine as it is, and it's important that we also learn how to adapt to the healthcare innovations that are present right now in this dispensation. And so my question is, how do we motivate this present generation of medical doctors and healthcare workers to buy into these digital health innovations early enough so that we can have maximum results in the end? places where there's not much access to these sophisticated technology systems. And so the question is, how do we encourage students and healthcare professionals such that they can pay attention to these healthcare innovations and not get discouraged in the long run? Pharmacist Ibiri, we understand that technology largely deals with data collection, and we are probably lenient in that aspect in this part of the country. Does that not pose a serious challenge to our development in healthcare innovation?
Well, I think that it does, because the importance of data to like medical outcomes and health, digital health in general is very large, because with data, the presence of data, because earlier this month, I was on a panel where I judged a hackathon where a group of pharmacists, they used data, they used gradient boost algorithms to create a machine learning language that could predict and forecast inventory for pharmacies to help them reduce expiry. And one of the issues here for that particular solution was the fact that there is not enough data to put into the system to even predict or forecast what can happen right now. exactly. And it is because there is not enough data to put into the system for it to be able to predict. So yes, we have a shortage of data. And a way that we can start to correct that is to standardize processes for how we store our data. There is a way that the government, because this is not what a private sector can take on, it has to be regulatory framework from the government to put together how data should be collected, how it should be stored, how it will be secured, put together all this, the framework, what levels of permission do certain people have with data. If a health tech company is building a solution and they need patients' data, who sees what? I think that is a very, very important step to take. And the next step, which takes me back to health is to also explain to the public why we need this data. We need this data so that it would help us manage outcomes. We need this data so that it would help us plan properly for the public. If I tell you that I need your age, your health history, I need your allergies, I need the medication that you have taken before, so that when I am making a care plan for you, I understand based on all of the information that you have given me, and I know how to move forward. If you're allergic to this, I'll put it in the system so that no doctor moving forward will have to give you this medication when you show up at a clinic. So if we explain these things to patients, I guess it will be easier for us to get the data from them. If we have a standardized way to store it, it will be easier for us to keep the data and then use moving forward.
Thank you. You answered a question that was lingering on my mind, which was how we could answer to the problem of poor data collection. However, for Dr. Kent, we recognize that in medicine we pay attention to ethics and confidentiality, and so in pulling data together for healthcare and for programs that might be important for us with healthcare innovation, how do we ensure that we do not breach this trust that we should, and how are we sure that we can navigate ethics and privacy challenges with data collection and usage? same way, I would like to ask that what actions do you think healthcare professionals and stakeholders have to take to ensure that they are getting prepared and ready for technology and for
First of all, I think that young people are innocent of this situation. When she asked how many people are interested in technology, there were quite a few hands. So I do not think that young people embrace technology is an issue. That young people are actually embracing technology. So I think that it is up to the government to put programs and educational seminars in place to guide them on what it is, how can they understand more about it, and even compete with their peers in other countries. So I think that it's important for the government to do that for its youth. I think that on a personal level, health practitioners and health providers should also try to put themselves out there and embrace trends. I know that some people might be scared that the advent of AI will replace them. But I'm almost sure that it will not replace health providers. If anything, it will help. Last statistics I came across is one pharmacist to over 200 patients. And how do you want to be able to care and attend to 200 patients at a go? But with the presence of AI, it can help you with medication dosage, it can help you quickly check some facts if you need to cross-check some things with some medications or side effects. AI can help you with that very quickly and it gives you more time to actually spend with your patients. So I think that health providers should embrace AI trends, learn more about it, put themselves out there, as the government also helps with programs to educate the youth in general and then health practitioners too.
Yeah, I think from the government's perspective, I think collaboration, a collaborative environment, creating a collaborative environment, because a couple of young people probably have like different ideas how they can come to challenges and difficulties. Creating that enabling environment such that when they are done with school, they see that my ideas will probably do something productive and probably solve a problem in the economy, sorry, in society. So collaborating with the government and giving them that awareness that they are ready to accept the ideas, we are ready to work with you to tackle these problems. And then also from the perspective of the medical practitioners, I would say that a continuous upskilling of yourself will help because technology that you know of this day may not be technology that will be used next year, may not be technology that will be 10 years time. So technology will always evolve. There will always be exciting things that will come up.
understand that there is an investigation to doctor ratio in this country. Are there any issues, issues that has helped us to address that issue? How to if some questions can appear to be take that
I would say that I know what that's where I work currently in pharmacy, we're currently working on the product called Rami is supposed to be a guide, a helping hand for pharmacists and medical doctors. Yeah, for medical doctors and health providers all together. For me, is an AI assist, and then it helps you with information on how to manage your patients. It's a hospital pharmacy, where you have limited time to attend to a whole lot of patients. What Remy does for you is it can scan your prescriptions, and then it can also you can scan your prescription, you can speak, and you can also antibiotics, let's say Ampiclox for example, and as a pharmacist you cannot put everything in your head. As a medical doctor you cannot remember everything too, and you can ask Remy, what dose does a 5-month baby need, what dose of Ampiclox does a 5-month baby need, and how should I prescribe it? And Remy will be able to help you with the dose and how it should be given in divided doses. So that is one I can tell you that we're currently building right now. It's going to be available very soon, and it will be a game changer for pharmacists and doctors to manage their patients better, so that it reduces mistakes. You're able to give the best care because you can ask Remy for proper pharmaceutical and medical advice for patients, and it can help you reduce time wastage and optimize patient care.
Thank you very much. Ladies and gentlemen, without a doubt, we've seen that the emerging healthcare innovations in medicine are ideas that would go a long way into ensuring that we deliver optimum patient health care, and so that we have maximum results in the medical field. And so it's important that we take note of the things that we've learned here today, how we should upskill, how we should make sure that we get better and embrace this advancement in medicine to ensure that we are better doctors and to ensure that our patients are our patients come out better, which is majorly the goal for medicine and is the end goal for healthcare innovations in medical field. I want to thank all our panelists for joining us today. It's been a great pleasure having you around. Thank you very much. And then I pray that we wish that you have a very good season leaving this place. Thank you very much.
Thank you. Please, let's put our hands together again for them. Let's put our hands together again for them. Who is learning one or two things? Who has gotten anything? Is there anyone that would like to share with us? Anybody? Come and tell us what you learned. Can you raise your hand? Don't raise your hand, I'll pick you. Who wants to share with us? What's the one thing that stood out to you in this session? Nobody wants to share. Okay, I'll go into the crowd and pick one person. This auntie that is wearing green. You look so pretty. Please come and share with us what you learned today.
I learned quite a lot, but what stood out to me was the part of upskilling, embracing new trends, and trying not to stay still. So yes.
Oh, please put your hands together for her. Thank you very much. So right about now, we'll be having Dr. Ikechukwu. Is Dr. Ikechukwu not very handsome? Please put your hands together for him. All our speakers are so beautiful and handsome and intelligent. I mean, it's overwhelming. So right about now, I'll be calling on Ajao Timileyin to take the citation for Dr. Ikechukwu. And while he's doing that, please let's clap for him. Let's encourage him. He has tried. He has tried.
Okay, I'll be taking the citation of Dr. Ikechukwu Amechina. Dr. Ikechukwu Amechina is a graduate of the University of Lagos, where he obtained his Bachelor of Medicine, Bachelor of Surgery, MBBS degree. Over the years, he has built capacity in many fields like medicine, data science, organizational leadership, claims management, to mention but a few. Before moving to Reliance Health, he served in many renowned health organizations, like serving as the house officer at Lagos University Teaching Hospital, served as a medical officer at Eluama Health Center. He also served as a medical officer at Standard Life Care Hospital, also a medical officer at Lagos Executive Cardiovascular Center. At Reliance Health, an organization aimed at making quality healthcare affordable and accessible in emerging markets by using data and technology. He has served also in many capacities, like claims associate, claims automation associate, interim claims division lead, and he currently serves as the senior claim operations executive and claims team lead, where he collaborates with the product and technology team and other stakeholders to develop and execute claims management and spending control mechanisms, including automated claims processing systems that continue to delight their customers. Please, with a standing ovation, ladies and gentlemen, can you welcome Dr. Ikechukwu Amechina into our presence?
I think this is yours. Thanks, guys. It's really weird to stand beside him and hear my citation. I think that was off LinkedIn. It sounded very LinkedIn-ish, yeah? A lot of things in there. My name is Dr. Ikechukwu. What have I done? I work at Reliance Health, medical doctor. I work at Reliance Health. I lead the claims team. Basically, our idea in Reliance Health is to deliver quality healthcare to Nigerians in a way that is affordable, accessible, delightful with data and technology. Okay, it's one of the things, one of my greatest achievements is that I was able to pioneer the first automated claims processing system in Nigeria, maybe West Africa, yeah? And that's really awesome stuff. Thank you. So I'm supposed to talk about strategic healthcare financing today, and you guys have had quite a long session, so let's make it engaging and let's raise the stakes. So I will talk, everyone is looking up now, okay, great. So I will talk about strategic healthcare financing, yeah? I will give out 4 questions. Okay, whoever answers them, first person to provide the correct answer will win a prize, small monetary prize, so at least that gets our attention. You will need your phones, your browsers. Yeah, be ready. All right, so first of all, let's talk about universal health coverage. What's the idea of strategic universal health coverage? I'm sure we're all used to that term, yeah? The idea is just that, you know, everyone should have access to full range of quality healthcare services, okay, whenever they need them, wherever they need them. So if you think about the keywords, I would say everyone, yeah? Everyone access full range of health services. You're thinking health services, I'm thinking primary health service, dental, rehabilitative, mental, yeah? Immunizations, yeah? And then, of course, quality. Cannot be shabby. And then whenever they need them, wherever they need them, without catastrophic expenditure, without having to sell a house, sell the family land, sell the car. And you're thinking that exact scenario where they bring the man in at the emergency room. He's on the bed, he's had heart, and then we go, can we get 100,000? Can we use 20K to buy, 20,000 to buy admission pack? And then oxygen, and then he's on oxygen for 6 days, 10 days. And then what happens? We sell the bukata in the house. Yeah, and then we call Uncle Femi, Uncle Tunde, and then we do a family funding, and then we each through everything. His admission, 14 days now, okay? And this is the scenario we're trying to prevent. We're trying to make sure that when that day comes, families have something to fall back on. It's not just the money you pay out of pocket. The system has to be there for you. That's the idea of universal health coverage. In order to achieve universal health coverage, by the way, can I get like a timekeeper? Someone volunteer as a timekeeper. Thank you very much. I want you to wave to me. Maybe I hit 5 minutes right now. Yeah, every 5 minutes, just wave to me. So what's the idea of how do we make universal coverage, health coverage happen? Well, you need a bunch of things. You need policy, first of all. You need a law that says, you know what, I'm going to create universal health coverage. After you start with that law, I feel like asking the question. This question has no money attached to it, yeah. Hold on, this is free. So you guys are aware of the recent, the law that established the NHIA, National Health Insurance Agency, yeah? Is anyone aware of that law, when that law was enacted? Anybody? No money, just anybody. Yeah, shoots, when? 20 what? Perfect, May 2022. That law, as someone who works in health insurance, that law has given me a headache. It's a good law, but like, God. All right, so May 2020, you need a law that says you guys need to care for the citizen things happen. Then you need an agency to make that law happen, and that's why we set up the National Health Insurance Agency in Nigeria, yeah? Then of course you need something, you need the rubbers, the funding, and this is where it starts getting really tricky, because you can say all you want, you can do all you want, but without the money, nothing will happen. I think, yeah, I have the first question. So this one goes for 5K. Fastest fingers first. How much was budgeted for healthcare funding in Nigeria 2023, and what percentage of the total budget was that? Let's go. So I'll continue. Immediately you get your answer, raise your hands up. So what's the role of health funding in universal health coverage? Without the money, nothing can happen. There are a bunch of things you want to happen when you're trying to do universal health healthcare coverage. You need to make a bunch of things happen. You have workers to pay, you have hospitals to buy. Yeah, you have drugs you need to make, you have service delivery, you have to pay people's, the management too. A lot of things, yeah, but you need that money. So typically, most healthcare systems will achieve universal, okay, I see, any hand, a hand. Okay, I saw a hand first, yeah. 1.17 trillion, what percentage was that? 5.8% correct. So Nigeria spent its largest amount in a while on healthcare, and it was just 5.something percent. This is a bonus question. It wasn't planned initially. Who knows? It'll probably take you 30 minutes. Who knows what percentage of healthcare funding was spent all those resources in such a way that it answers the problems? And you're thinking of all the biggest problems we have in Nigeria. We have the problem of malaria. We have the problem of child neonatal maternal mortality. Yeah. How can we solve those problems? Yeah, we have a problem of access. We have a lot of hospitals, private hospitals in Lagos, in Ife. We have a lot of public hospitals. Yeah, I worked in a place that had no hospitals for miles and miles and miles and miles. So how do we solve the issue of access? Okay, fine. So you have a hospital. What about affordability? Yeah? What about affordability? Okay, fine. You have a government hospital. What about maintaining the infrastructure? What about maintaining infrastructure? What about paying the salaries? What about accountability? Everyone has that thing in their mind when the CMD of a certain teaching hospital is driving past in his Jeep and we're like, So how about accountability? How about governance? It's there. Yeah, feel free to suspect. How about government? How do we deal with brain drain? You're all leaving. Aren't you guys leaving? You guys look like you're leaving. How do you do with brain drain? So how do you keep your best urologist, your best cardiologist? Do you know what keeps doctors? Do you know what keeps doctors? Money. How can we keep them? So those are the problems we're facing in achieving UHC. It's not just the funding. Has anyone heard about the UK? You found out? Okay. You guys will find out. Right? So it's not just about the funding. It's about strategic allocation of those resources. So many things to do. You have a whole primary healthcare management, like primary healthcare board. You have to manage primary healthcare. It's everything, yeah? But then you have vaccines. You have vaccines now. And then COVID vaccine came and was like, look at me, I'm going to scatter your budget. You found out? 5 minutes, thank you very much. So let me switch. So COVID vaccine came, and then there's mental health here, and then there's maternal, like family planning. How do we make family planning accessible to everyone? Because Nigeria's birth rates is skyrocketing, yeah? You have the answer? Sorry? 185. Come on. 185 billion pounds. What percentage was the budget? The budget was that. Oh, everybody knows now. Okay, she doesn't have the percentage. Has half. Who knows? One what? 160.4 billion. 85,000. It's not 85% of the budget. Okay, to save time, yeah. Maybe like you can pull in your answers. I don't know if there's a polling. So if you have like a chart, you can pull in your answers. But it wasn't. Let's leave it. I'll come back to the end to save time. But listen to what we are getting. You had 160 something billion pounds, 180 something billion pounds. Can someone quickly convert that thing to naira? Let's hear how much that is compared to 1.17 trillion we spent on 148 million, 200 million people. Yeah. So compare. Funding is everything. So what do we do? What are we trying to do? Let me show you this trick that Rishi did. It starts from policy, then you make a health management system. We talk about that, yeah? Then you do the funding, then you have to do the actual hospitals, the infrastructure, yeah? Then you have to do the service delivery. Rishi Sunak. Who knows Rishi Sunak? You all know him now. Yeah, that guy was public enemy number one throughout Africa for like 1 week. And do you know why? Because in order to increase the funding for the NHS, this guy goes and increases the surcharges for IHS. He increased the surcharge. So the surcharge is like a fee you pay to the UK government because you are coming as an immigrant, yeah, into the UK. And you pay it. It's supposed to cover your health insurance and whatnot. He increases from £624 to £135 for every person. Please, can anyone calculate? This is the second question with money. Can you calculate how much Rishi Sunak was able to raise for the UK with just that move? Can you calculate that? Just that move. There are a bunch of other things, but with single move. And he looked and said, what is UK's number one problem? Immigrants. Sorry, it's not immigrants. Health, yeah? So, but what do they think is their problem? Immigrants. Let's build them. You know how we say in Lagos, if you build it, yeah? Perfect. So let's build them. From 624 to 1,035. How many immigrants come in? Someone has an answer. Shoot. For what? 4 million what? Billion pounds, yeah? That is a good amount of money. Thank you. You're correct, by the way. So, just that move, apart from a bunch of other things. Please convert 4 billion pounds to naira. What did you get? Error. So basically, Rishi Sunak put off a move that is fighting against the whole of the country's budget for the whole of 2023. Financing is a big deal. So how do we solve those problems? Typically, I'm running out of time. I'm trying to show you the scale of the problem and probably just stir up the questions in your head. So typically, most people would decentralize the problem. You know, in UK, what they have is they have NHS trusts, and then you get the funding as the government, and you give the money to the trust to maintain. The trust is like an organizational unit that runs a bunch of hospitals. In Nigeria, what we have is you have like a primary healthcare management board, and you have like tertiary hospitals, secondary hospitals, and whatnot. You give them money, and then when you give these hospitals money, you're going to face the following problems. You're going to face, I'm sure you guys know those problems. So you've given the money to CMD of Jagbajanti's University Teaching Hospital. 5 minutes. Thank you. You've given money to the CMD of Jagbajanti's Teaching Hospital, yeah? And then what's he going to do with that money? He has to, this is governance. He has to strategically allocate funds on what? How does he pay salaries? How does he invest that money? How does he get equipment? How does he build structures in the hospital? How does he even account for? Yeah. How does he raise extra money? Because the idea is he's not supposed to get all the funding from a single place. How does he raise extra money? How does he advocate for more money? The same thing happens at a higher level too. All the guys who are in the corridors of power, they are trying to advocate for more money, more control, give more money to the health service. But then accountability is a problem. Accountability is one of our problems. Fine. So you've given the money to the CMD of whatever, or you've given money to the board, the primary healthcare board. That access is still a problem. Yeah. How do we make sure that this money is equitably distributed? How do we make sure that you've released 60 million naira? Yeah. Most of the money is going to go to health facilities that are in urban areas. How do we handle the issue of inequitable distribution of healthcare? How? So who's going to, the funding that goes to the primary health clinic in the village is going to be how much? Strategic allocation of healthcare. It's a big problem. And that's why you need a health plan. You need like a plan where you're going with your health system. Does Nigeria have one? So let me give you an example of Lagos State. Lagos State health management system. Let's follow the rule. Lagos State enacted its health policy, set up a Lagos State health management system, LASHMA, set up a Lagos State health insurance scheme, health scheme, which is their funding. So what the health scheme does is it takes 5,000 naira from any Lagos resident per year, and then it adds a lot of Lagos money. Where does Lagos get its money from? Taxpayers. But now, anybody that's a resident of Lagos can walk into a place and at least be sure that they can get drugs for malaria. Okay, and they have a plan. How did they enact this plan? They're thinking, first of all the public health facilities in Lagos, all the primary care clinics, you can use your Ilera, all the tertiary, secondary care clinics, government hospitals, like Rando general hospitals, that's what we call general hospitals, you can use your card. Tertiary hospitals, you can use your Ilera Echo card. Then they come and say, but we have a problem of access. We don't have primary health care clinics everywhere. Guess what they do? They enter into partnership with private hospitals and HMOs. And they say, you know what? Let Ilera Echo card be recognized when you come into Divine Health, Fresh Boys hospitals, Fresh whatever. Let them, we will pay you. They had to create something credible structure that says, if I come in with my Ilera Echo card, please attend to me. Lagos State as a whole is closer to that UHC goal than the country. You have to agree, yeah? How do we get the money to this? So, in tiny, microcosms, you can easily do a public-private partnership. I can think of a bunch of some. By the way, who funds Nigeria's vaccine? Another question. Who funds Nigeria's vaccines? 5K, first answers. That's not the answer. Who funds Nigeria's vaccines? Who? Yeah, another question. Who funds Nigeria HIV and AIDS Prevention Initiative? Who? These are key. Remember, these are key areas to allocate resources to, apart from primary healthcare. You need to fund vaccines. You need to fund. Yeah, who funds them? All right, so I think what we've done is we're able to flag, okay, yeah. NH for vaccines, yeah? Yeah, so Nigeria actually funds is majority, like 70% of the funding, believe it or not, at least 60 of the funding comes from Nigeria itself, okay? And a bit comes from Gavi. Everyone knows Gavi, yeah? I mean, there's people who've done public health. Shoot. AIDS Prevention Initiative, you have that, yeah? Sorry? Bills and Melinda Gates, correct. So they fund the HIV and AIDS Prevention Initiative. This question has no money attached to it. Do you know what the same-sex marriage law did to that funding? Do you know? Be curious, find out. Just read up. It's tea. Just read up and see what happened to that, or how it threatened that funding or whatever. So finally, you can do a public-private partnerships. This is one of the most common ways we try to surmount all those odds, yeah? Because number one, you need to have money. You need to have money, but the government has so many things to spend money on, and you're only getting a tiny chunk of that money. So what happens? You call a private and you say, hey, can you invest in me? A very good example is the radiology center at FMC Ebotemeta. Okay, so they called a company came in and got them equipment and started training the staff. Okay, and then they provided the structure, they provided the security, they provided the patients. Thank you, this is the last 5 minutes. And so the idea was, if you make X amount of money, this is our partnership, we will remit a percentage to the public-private partnership. Another really brilliant way that we can fund stuff is when you actually ask government, and say this is a priority. This is, if you think about the NSIA, Youth Cancer Care. I don't know if there's another NSIA. There's one at, I think there's one at Abia. Yeah, so NSIA is Nigerian Sovereign Investment Authority. it's just basically all the excess money from oil. Oil money is a lot. Sometimes it's excess. So people went and said, why don't we invest this in cancer? Because cancer care is a huge gap in our healthcare systems, yeah? So, and then they started making these partnerships where someone invests, they make new buildings, have the best equipment, train the right people, pay them, of course. And then that was really going. So those are the ways we can get things going. But overall, most of the funding, most of the any approach to healthcare, to achieving universal healthcare coverage, that relies on healthcare financing is going to mostly be driven by the government. Okay, I mean, I work in a private insurance company, apart from a healthcare company, it's an insurance company, and if you put all the insurance companies together, our coverage is nothing compared to the coverage that the NHIS will achieve if you keep on expanding it. Okay, we can participate, we can support, but it's nothing. And it all starts from what? It starts from getting the funding. And how do you get the funding? You prioritize. Yeah, you make policy that's really smart, like Rishi Sunak. You make really smart policy. You think, what are my weaknesses? How can I make them strong? You innovate. You have to innovate. So then you think, how can I increase the healthcare delivery across Nigeria by reducing costs? While reducing costs, how can I do that? A very good example of innovations in private area is telemedicine. Via telemedicine, everyone knows you have increased access. Telemedicine consultations are very cheap. Yeah, you've increased access and you have handled the problem of affordability. As long as you have network, you can have a consultation. That has increased access. It's not going to get to the people deep down somewhere in, I don't call anyone's local governments, but in the village, yeah. It may not get to some people who don't have the best connections, but it's a step at a time. You innovate. You can't take away innovation. So as you, student, as you go through school, as you go through the university, there's one thing you have to bear in mind, is that there is this really huge opportunity to do something groundbreaking, okay, in public health. I mean, we could have like 1 million people join public health today, but there's a problem to solve. And I want you to take note that this problem has to do with, number one, how do I raise funds? How do I strategically allocate this to achieve these objectives? Immunizations, HIV, primary health care, maternal mortality, whatever. How do I make sure that the people who manage these funds are accountable to me? How do I have impact? You cannot have all that spending without impact in health indices, and then how can I innovate in such a way that it benefits the community? Thank you very much. How much do I owe? How much I owe? How much? 15? All right, thank you very much. It's been really fun speaking with you guys. Have a great day.
Thank you so much. Ladies and gentlemen, one more time, let's put our hands together for our guest speaker for today. Come on, our clap now. 3, 2, 1, let's go. Thank you so much. All right, ladies and gentlemen, information reached to me is that our food and our souvenir is ready. If you are hungry, clap your hands. Calm down. Tell your neighbor, calm down, it's coming. It's coming very soon. All right, so please stick around. They'll be very soon. So please remain seated. Don't move around. So they will give you wherever you are seated. So make sure you don't leave yet. The souvenir is coming. It's a lot. It's plenty. You might even get double portion safe. Don't worry. It's plenty. Oh, yes. Well, because you say, oh, come and collect. Come and collect. Stay here. Can you catch? Please avoid your head, oh. Let me give her. Thank you. Give her. I'll give you your own. Give her. Shall she get her? Thank you. All right, so ladies and gentlemen, remember, stick around. This is the Ifumsa's Health Week, and I'm looking for a way to disperse all this battle before I continue. I'm going to be calling our president very soon, but before I do that, I need to finish this thing. Yeah, you take. Yeah, take one. Take one. Oh, yeah, take. If you are wearing red clothes, wave your hand. Oh yeah, red, take. Who is wearing yellow? I'm giving you all the primary colors. Yellow. Who is wearing yellow clothes? Okay, you are wearing yellow. Come and take. Take, just. Who is wearing pink? Anybody with pink clothes? Let me go to that place. Let me go to that place. Don't worry, there's still plenty souvenir. You will still receive your own. Just calm down. Here. He said there's plenty. Who is pink? Oh, yeah, take. Okay, let me give a guy. Sorry, I've been giving girls since. Let me give a guy. So they will not say I'm sexist. Purple. Who is wearing purple? Okay, let me. This is not purple. Is that purple? Oh, yeah, take. Which other color do we have? Who is wearing cockroach brown? Cockroach brown. Where is cockroach brown? Okay, I can see cockroach brown. And lastly, who is wearing? Okay, we've done blue before now. Blue was our commission, was Provo's favorite color. We've done white. White was commissioner's favorite color. Who is wearing? Wait, you are wearing no color. Who is wearing turquoise? Now here we will catch them. Who is wearing turquoise? What is the color of turquoise? Oh yeah, if you have rainbow color, I want to get one that is wearing rainbow. I can see rainbow. Congratulations. There's still more. Just stick around. You get your food, your souvenirs, and everything else. All right, ladies and gentlemen, join me as I welcome the 001 of the president of the Student Association of Medical Students. One more time, please join me as God for Dr. Kolade Adegoke as he comes up on stage. In the next 5 minutes, Mr. President, please just do what to do. Thank you so much.
All right. All right. Good afternoon, everyone. Media, can you kindly project my slides? All right. Good afternoon, everyone. Good afternoon to our keynote speaker. Thank you very much, and also our panelists. We're very, very grateful to have you join us this afternoon. We would like to call for your support for a course I am very passionate about, the Ifumsa Indigent Student School Trust Fund. That's the tag. It's poised to be our final administrative project for the year. Introductions. Ifumsa, we are Medical Student Association of Bafemi University, Ile-Ife, and we are a vibrant student community, and we boast of a membership of over 700. All right, over 700 membership, and we have an esteemed alumni list of over 6,000 medical professionals in different domains. Now, our background. In the light of the essential economic realities we come to find ourselves in this country, and on Thursday, 23rd of March 2023, we're informed via our college colloquium about the intention to introduce a professional training fee to a sum of 100,000 naira. In another release, which was issued by the school management on 13th of September 2023, students from College of Health Sciences we were told we would have to pay a sum of 109,000 naira. These fees met a lot of resistance, apprehension, and a wave of inquiries amongst students. Still on the background, in a comparative survey we conducted following a couple of our congresses, we realized that quite a number of us are actually struggling to even consider paying these fees. Now, we realized about just 20% of Ifum sites could afford 100,000 naira professional training fee, or even 75,000 naira professional training fee. And just 63.7% of Ifum sites could pay 50,000 naira. While it's even more substantial that 80.5 Ifum sites could afford up to 25,000 naira. These statistics provide a stark representation of the financial limitations faced by our members. Now, we were still fighting this. when we were told by the school management they have to increase our school fees. And we did not conduct a follow-up survey in light of this. But it is clear the number of individuals capable of meeting these revised fees is expected to be notably lower. What is our reality? Many of us are poor. For many of us, we chose a federal university like Obafemi University due to the small tuition fee. While we acknowledge the efforts of our fathers in college to see in the affairs of some of the possibly affected students, we are truly concerned about how our indigent members will fare even as they resume the new session. As a community, it is our responsibility to stand together, ensuring financial barriers do not impede the journey of these aspiring medical professionals. I implore each and every one of you to consider contributing to this cause, to support the dreams and aspirations of these young minds within our association. Thank you for your attention and your consideration. Let's make a difference together. Thank you.
Thank you so much, Mr. President. I can see the Women Bank account Medical Association. Another account you can transfer to is 220927555 Zenith Bank. The name there is Lady Kayode Daniel. As I transferring to this one, also transfer to that one too. Thank you. May God bless you as you donate to the good cause. It's a joke. I beg, this is the only account. I mean, I don't consume me. All right, so ladies and gentlemen, we are gradually approaching the end of the event. I can see my welfare members are bringing in the food and the jet one after the other is going to reach you very soon. We're not joking. Trust MCK, trust King K. It will not lie to you. So just stick around and stay for a bit. So ladies and gentlemen, without wasting much of our time, without further ado, we'll be calling them up for the launching of the Caduceus magazine. So please, can I have the representative from the Caduceus magazine? Yes, let's show us God for ladies and gentlemen. Come on.
I wonder about life and its faces, my future sags and wrinkles, and past secondary school girl stages. I wonder how I was once a 3-year-old. I wonder about how we are all living the same life and in different households. I wonder about how we are all living the same life and in different households. We all experience life's beauty and pain. We all experience earth's sunshine and rain. It eats me. We are not so different after all. Me and you. I have a vivid and complicated life, and you do too. What eats me? Well, it can only be the wonder of sundown.
Okay, I'm thrilled beyond words to offer you a sneak peek into the 9th edition of the Caduceus magazine. Can you put your hands together? I am very, very excited. Very, 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 very excited. I need us to intensify this clapping. Can you put your hands, jam your hands? Okay, so over the years, the Caduceus magazine has brought color to Ifumsa, the medical and literary communities through top-notch content across various niches, several inspiring interviews, highlights of various events Ifumsa has been involved in during the year, and many more qualitative articles for a well-rounded reading experience. This year's edition is no less, and I can guarantee that every reader will find something to learn from and to hold on to from this edition of the magazine. Caduceus 9 is themed Sunder, recognizing unique stories in everyday faces. It describes the profound feeling of realizing that everyone has a life as rich and as complex as yours, from the person in your corner, from the person beside you, to the strangers you encounter in fleeting moments. Each article, story, and interview dances around this theme to bring out the similarities and differences in our thought processes that are born out of the varying experience we all have simultaneously. Each interview is also unique in what it addresses, from Professor M.A. Kumalafe's view on medical education and medical practice in Nigeria to Dr. Hamilton's discussion on the pathways to a medical practice abroad. We explore the factors surrounding a well-known crossroad in the value of career decisions. That is, do you want to jackpot or do you not want to jackpot? In addition, a popular saying among we writers is to show, not tell. So instead of the regular love and relationship content, you'll be hearing firsthand the relationship experiences of Dr. Elizabeth and Dr. Samuel Luokandi in the maiden edition of our relationship hot seat. Are you excited? I need you to clap if you are excited. We are not showing, we are not just telling you. This time we are showing you. Furthermore, we have also added 2 high-yield interviews from the unpublished Kadishos 8, an edition that was dedicated to Ifumsa's 50th anniversary celebration. Professor Fatusi, the Vice Chancellor of University of Medical Sciences, Ondo State, and Professor Makpai, the first female, I suppose you clap now, you should be, first female professor of psychiatry. They tell us some moments from their times as Ifumsa and how it has contributed to the giant strides they have made in life today. We have also added a maiden initiative, 10 phenomenal Ifumsa. If you are an Ifumsa, I need you to clap. 10 phenomenal Ifumsa to celebrate members of the associations who are doing remarkably well in various fields alongside medicine. As I draw the curtains, I'm very grateful for the time I've served as editor-in-chief. It has been a journey beyond leadership, but one of self-discovery and development. I'm proud to have contributed my part in advancing the club, and I will always be proud to be associated with MediVoice and all that we stand for. To all, you are a driving force for all we do. As we sunder together, I hope you find pleasure and wonder in the pages to come and come to appreciate our commitment to always serving you with the best. Can we put our hands together if we are excited? So I'll just go quickly into why should you get a copy of this magazine. We've done a bit of an overview to just show you some of the contents that is inside. That's just a tip of the iceberg. Tell someone beside you, that's the tip of the iceberg. Tell the person, I need to hear your voice for him. Say that is just a tip of the iceberg. From interviews to content, from medical content to content about Nigeria, we have this magazine is packed for a 360 experience. I mean, when you are reading this magazine, you are getting a 360 digest of everything you should know at this point of your life as a medical student. If you're happy, can you just celebrate that fact? Can you celebrate that fact? Okay, so I'll just be going 3 reasons why you should get this magazine again. First, it is packed with invaluable information. We got so many high-ranking people to come and tell us stories, and you know you rise by sitting on the shoulders of people who have also been like you. Professor Makpai was once like you. Professor Fatsu was once like you, and they shared their story. They shared their heart bodies. Dr. Hamilton shared stories about how he came to go abroad because he's an internal medicine resident in the United States, and he owns a tutorial. He's the founder of the Hamilton Academy, a leading prep tutorial academy. So if you've been wondering, okay, how do I jackpot? Should I do this? Should I do that? This is an interview that has everything you need to go. Do you want to go to Australia? Do you want to go to Canada? Do you want to go to US? His interview is power-packed, is filled with all this. Kadishos 9 is also a memento. I didn't really talk about this here, but we have a photo splash of Ifumsa in the last 1 year. All the activities, from feminist activities to IACS, every single activity we had this year. We have a summary of it. So you're not just getting a magazine, you are getting a memento of what this year has been about if you're an Ifumsa. Okay, it also tells your story. From what you read, Sunday is a realization. Just as I'm staying here, the person beside me has a life complex. This person beside me has a very complex life. That person staying at the extreme back has a very complex life. And we talked about it, how it relates to the medical field, what we can gain for this team. There's a lot to gain from this team. It tells your story, it tells my story. Kadishos 9 is not just for me. It's not just for MediVoice. It's for you. Tell somebody Kadishos 9 is for you. Kadishos 9 is for you. So how do you get a copy? I don't know if the account number can be projected. The copy is going at a launch price of 3,500 naira for this hard copy. For a hard copy, can you put your hands together? I need to clap now. We are doing this together. 3,500 naira for a hard copy in this Tinubu's economy. In this Tinubu's economy. I don't know if you are surprised. If you are surprised as I am, quickly pick a copy, pay for it, and we'll also be selling a soft copy. Soft copies will be available. They'll be available after the launch. And the soft copy is going for just a token of 2,000 naira. So please, can you indicate to any of them if you want a soft copy? We need to get your names. We need to get your contact information so that we can send the soft copy to you. Okay, so we'll be doing that downstairs. If you need to get a copy of this magazine, in fact, this hard copy is unlimited. It's limited edition. If you need a copy of this magazine, please meet us downstairs. Our stand is downstairs. Quickly grab your copy. Tell somebody, grab your copy now. Grab your copy now. It will finish very soon. So with this, we come to the end of the launch of this magazine. The magazine is now available. You can get a copy from any of us outside. Can you put your hands together? together, not the phone site. Thank you.
So, ladies and gentlemen, make sure you grab your copy. Yes, and I also got information that there are some people in the audience that answered our guest speaker's questions, they answered Ikechukwu's questions. Please see Stephen. Stephen, please, can you wave your hand? That's him over there. If you are part of the people that got his questions correct, that is him over here. He's wearing a tag on his chest. He's waving his hands. He's a very handsome man. Very, very handsome. Yes, he's the one paying my balance too, so thank you so much. So see him. He'll be the one to give you your, to link you up with our guest speaker for you to receive your giveaway. All right, so ladies and gentlemen, you've heard that Kadisha's magazine. Make sure you grab a copy. If you've not gotten your food, let me see you wave your hand. Let me see first. Agree to boss. Agree to. Every time that guy will blue. No be that one. I don't be time before. The one will I agree to boss. All right, so ladies and gentlemen, we are gradually coming to the end of this event. In case you don't know, my name is Alade Kayode Daniel. They call me King K, the king of entertainment. I'm one of the best MCs in the world, and I'm the MC for today's program. Next up, we'll be having the award ceremony to celebrate our panelists that have traveled from far and wide to join us on this beautiful occasion. So without further ado, it's time to call the 001 of Ifumsa one more time. Please welcome on stage President Kolade Adegoke James.
Thank you very much. I would like to call on, I would like to have on the stage our guest speaker, Dr. Ikechukwu. Yes. And also, I would like to have, all right, I also like to have pharmacist Kemi, Oluwakemi, join us on the stage to present this award. Here we have an award of excellence to Dr. Femi Kuti. Yes.
The Medical Students Association, Obafemi Awolowo University, Ile-Ife. Award of Excellence presented to Dr. Femi Kuti at Oduduwa Hall. You receiving it?
So where's the photographer? For Larry? Sorry, before you.
So this award is for Reliance HMO. It's an award of excellence in transformative healthcare, and it is presented to Reliance HMO. Well done.
At the same time, I would like to call on Ms. Busayo Omoni to join us on the stage. We have another one, please. First. Yes.
Okay. Medical Students Association, Obafemi Awolowo University, 36th Ifumsa Health Conference Award of Excellence in Transformative Healthcare, presented to Dr. Ikechukwu Amechina, this day, Monday, October 30th. Thank you.
At the same time, I would like to invite our guest speaker to present this award to. Where's the other one? Okay. Yes. To Miss Busayo Omoni.
On behalf of the Medical Students Association, OAU, I'd like to present this award of excellence in transformative healthcare to Busayo Omoni.
Right. I would also like to call on Mrs. Busai Omoni before she takes her seat. In presenting his award to Farm Oluwakem.
All right. Medical Student Association Award of Excellence in Transformative Healthcare, presented to pharmacist Oluwakemi Ebere. Well done.
Oh, you want to hold your award? I only look to get award.
Alright, you can take a picture. After you take this one, you take the one that I'll be inside too, so I can show my haters that I've made it in life. Thank you. Yes. Have you taken it? We are taking another one. I want to prepare my haters today. Are we good? Yes. Oh yeah. Let me hear you, please. I want to prepare my haters. Oh yeah, take another one. King K was here. Let them know. It was fine, sir. I'm posting it too. Oh yeah, snap it very well now. My leg don't pay me, I beg. My leg they pay me. Oh yeah, thank you. Okay. Thank you. Thank you so much. Ladies and gentlemen, let's join us for putting in so much time. Thank you so much, Mrs. and Mr. and doctors and Dr. Mrs. We appreciate your time spent here. We appreciate you. We do not take it for granted. All right, ladies and gentlemen, like I said, this is the Ifumsa's Health Week Conference. Yes, the 36th Ifumsa Health Week Conference. And I'm sure we've learned a lot. As we are learning, another thing I would like is we also connect. So please, look to your left, look to your right. The person sitting beside you, collect the person's number. You don't know where people can meet in the future. And for boys, this is a chance for you to shoot your shot. Yes. So ask for your number. If you're a boy and the girl and the person sitting beside you is your crush, this is your chance. Use this as an excuse to collect a number. Collect the person beside you's number so you can connect and chat later on. You don't know where you can meet each other in life. There are so much souvenirs coming in, so please, we would love you to remain seated. There are still more coming in. Even though you collected, there are still more coming in. So we would love you to remain seated. We'll be ending the program very soon, so just chillax, just relax, and get what you can get. All right, so ladies and gentlemen, bring out your phone. Let me now do one airtime giveaway before I leave the stage. Just one. This one is actual airtime giveaway. Yes. Bring out your phone. Bring out your phone. Yes, in the spirit of connections, are your phones out? So take down my number, send me hi on WhatsApp so I can have your number so we can chat. I also want to connect to people. My number is 081 4724. I repeat, 081 4724. So just save it as King K. Send me hi and your name on WhatsApp, so I know that, oh, I met you at this conference, so you understand. So when I'm going outside now, I know that you come and meet me, like, hey, come and give me my number, come and give, I've already announced my number now, you have it. So please just text me on WhatsApp and tell me your name too, so we can connect. All right, ladies and gentlemen, if you've not gotten, please wave. I want everybody to receive first. If you've not gotten, please wave. It does not reach this side though, please take note. This girl is looking like she wants to beat me. It does not reach this side, please, Ejo, please, let's be quick about that. All right, we'll be taking the closing remark from the LOC chairman himself. Ladies and gentlemen, please join me together as we welcome on stage. No other person than, he was one that brought me to this event. Yes, he was one that told me that, Kay, you have to host my event. That's why I appreciate him so much. He knows what is good and what is right. Please welcome on stage, Raman. Please join me together, ladies and gentlemen. Raman, yes. You are bigger than what people say. You are bigger than what people say. Yes, this is what we call small body, big engine. All right.
Good evening, everyone. I am Abdurrahman Lawal Adedayo, and it gives me so much joy to give vote of thanks for the event today. We have been planning this event for a while, and Ifumsa Health Week is still ongoing afterwards. As we draw the curtain of Ifumsa Health Conference, I want to, on behalf of the whole team, starting from Mr. President, who has put so much into this event, my LOC chairman, Olowokere Stephen, who has also put so much into this event, and every other member of my team. I can't mention name, but then everyone knows so much they put into this event. I want to extend my sincerest gratitude to all attendees, speakers, and sponsors who have made this event a very huge, incredible, one-of-a-kind success. The team, Transformative Healthcare, is very important to me, dear to my heart, because only with this can we bridge gaps and build a community of better individuals. Your unwavering support to the member of my team throughout the whole of this event has been what has kept me going even when I don't want to. But then we have a team who has put so much into this, who are passionate about making things work, who want to see the event a success. Day 30th of October 2023, we made a huge success out of Ifumsa Health Conference. First Ifumsa Health Conference in the history of Ifumsa. However, 36 of its kind in our association. 36th conference, Health Week rather. So thank you so much for coming. Thank you so much for joining me. Thank you so much for making this a huge success. I sincerely appreciate all of you. Thank you and have a wonderful day ahead.
Yes, thank you so much, ladies and gentlemen. And now remember, the Carcidius magazine, if you want to get a copy, the stand is downstairs. Don't forget, it's on an early sale of $3,500 for an hard copy and $2,000 for the soft copy. That's just $2. Abi? Yes, $2 for soft copy and $3.5 for hard copy. And $1 is like $1K. And do the master. All right, ladies and gentlemen, thank you so much. Remember to greet somebody before you go. Remember to collect somebody's number before you go. Remember to collect somebody's LinkedIn, somebody's Instagram, somebody's Twitter. Connect with yourselves. You know you can meet in the future. And when you see me outside too, connect with me. Thank you so much, ladies and gentlemen. My name remains King K of the King of Entertainment, one of the best MCs in the world. Thank you so much for having an amazing time with me. God bless.